Welcome to our fifth and final installment of our Science and Technology Week. This is our big event that we hold each year to represent how important it is to shine a spotlight on our academic and research partners so that we can have science at our service for all of our policymakers. This is our fifth annual event, and we have hosted really interesting topics all along throughout this entire week. I encourage you to check out our website to learn more. There was a wonderful briefing on Monday on climate impacts to renewables. We had an excellent leadership roundtable, and we presented our Science and Public Service Awards. We highlighted our Science Fellows program, and today we are wrapping up with this briefing on the importance of data infrastructure for dealing with disasters. So hello, everyone. I am Amber Mace. I am the CEO of the California Council on Science and Technology. And I want to open this briefing today by acknowledging that I'm speaking to you from the tribal lands of the Nisenan people. Sacramento has been a gathering place for millennia for many tribes. So I'd also like to acknowledge the Maidu people to the north, the Valley and Plains Miwok to the south of the American River, as well as the Patwin-Wintun people to the west of the Sacramento River. Before I turn it over to our panelists, I want to spend a moment sharing with you about who we are as an organization and what we're taking on behalf of California to help build disaster resilience. So we are a nonpartisan nonprofit. We were created to be a resource to California policymakers in the executive branch and in the legislature and the governor's office to pull in and tap into this incredible network of expertise that we have in California, in all of the academic and research institutions in California and beyond, and help translate this information into useful, actionable, timely advice for policymakers, because the topics that we are dealing with as a society are so complex. And California has always been a leader in pulling science into the policymaking process. We can do this through briefings like you're here with us today. We have workshops that we host where we can dig more deeply into topics, and we can also produce peer-reviewed reports. We have a wonderful fellowship program that I know many of you are familiar with, our CCST Science and Technology Policy Fellows. They spend a year here in Sacramento doing a deep dive into policy. They are coming from across the nation, and we help them access a new opportunity, career opportunity for them to provide a year of government service and leadership training. So we are just absolutely delighted to welcome this year's cohort, and we're doing outreach right now for next year's cohort. Lately, we've been focusing in, as I mentioned, on disasters and how California can build resilience to disasters. And there's so much that goes into this. And so we have been listening very carefully to policymakers about what the priorities are, and then actively engaging with our research network to see what we can bring to the table to help inform how we can help reduce the impacts of catastrophic wildfires. And in this case, today we're talking about disasters and how data are so important, and the infrastructure for that data system needs to be in place for us to get the policymakers what they need to make science-based decisions. So I'm absolutely delighted to turn it over to our moderator, Michael Kleeman, and he is the perfect person to moderate this conversation. He is a senior fellow and a visiting scholar at UC San Diego. He is involved in several projects that relate to this particular topic. He is a volunteer partner and advisor to the president of the American Red Cross. He's involved in numerous teams right now related to pandemic response and artificial intelligence related to wildfire response. And we are very lucky to have him as the chair of our steering committee focused in on the work that we're doing on COVID and COVID-19 response. So Michael Kleeman, I'm turning it over to you. Please take it away.
Amber, thank you very much, and appreciate the introduction. What I'd like to do now is introduce the three panelists who will be providing the conversation and the input today. I also want to remind those of you that are attending that we want to get to as many of your questions as possible in this, so please post them, and then we will try to be as responsive as we can. But let me start by introducing Dr. Maxine Savitz, who is the former Vice President of National Academy of Engineering, and I'll let her introduce herself in more detail.
Thank you, Michael. I'm a chemist by training and spent my career, half of it in Washington, D.C., with the Department of Energy and its predecessor agency, setting up the conservation programs, and then worked for industry out in California, Allied Signal and Honeywell. And since I've retired, I've been active on various committees related to the Academy, National Energy Labs, and working with CCST, and particularly, as Amber mentioned, the wonderful Science and Technology Fellows Program. In 2009, I was asked to serve on President Obama's Council of Science and Technology, known as PCAST, and had privilege of doing that along with 20 other people. And John Holdren was the science advisor and head of OSTP, was the one permanent employee, and the 20 were volunteers. Had a very active group. We issued 39 reports in the 8 years, had meetings with the president, but of the 39 reports, 6 were related to the subject today. We were concerned with the H1N1 pandemic, electronic health records, systems engineering, and the like. Then in 2020, John Holdren contacted a subset of us who had been active in these programs to consider insights we might have learned and how we could have suggestions, mid and long-term suggestions. This is March of 2020, how the US response to the pandemic could be enhanced. And from March to December of 2020, we issued 6 reports. There is on the website, there is a link to that. And 2 of them, one recording strengthening public health infrastructure, and then epidemiology modeling, are all very, very relevant. And if I want to think about something related to the whole COVID-19, this is really the first global incidence of a pandemic that has lasted 3 years for the 21st century. We've had smaller ones, they were important and really affected, such as Ebola and H1N1, but they were much more localized in different parts of the country. What we didn't have now and is a 21st century in IT or public health structure system. And that is really what needs to be improved. So when the next pandemic arrives, that we're able to address it more quickly and more efficiently.
Thank you, Maxine, very much. And thank you for your past service for all of us. A quick reminder before we introduce the other two, if you want to post questions, there's a Q&A button, should be at the bottom or side of your screen, and you can just press on that. The next panelist is a colleague that I'm working with, is on the COVID disaster panel that was mentioned earlier, and he's from NSF, Jesus Alvelo Maurosa. Jesus, would you please introduce yourself and help us move forward?
Definitely. Thank you, Michael. Thank you, Maxine. And thank you, Amber, for having me. My name is Jesus Alvelo Maurosa. I am an engineer science analyst for the Division of Civil, Mechanical, and Manufacturing Division at the Director of Engineering at the National Science Foundation. I am involved in multiple initiatives across the division and the NSF. In the division in particular, I have worked in the Disaster Resilience Research Grants, which is a large solicitation between the National Science Foundation and the National Institute of Standards and Technology, where we have funded research regarding wildfires, flooding, coastal hazards, and other natural hazards that might impact the United States. As well, I'm involved in one of the NSF 10 Big Idea, which is the Navigating Arctic. I'm engaged in that working group in the last 3 years. I'm also the point of contact in that group in the United Nations Ocean Decade, where we're trying to coordinate initiatives between US researchers and international researchers. Furthermore, I served in the engineering COVID-19 working group when the pandemic started around 2020, particularly engaging in the rapid proposals and advising my divisions in that particular area. And as Michael mentioned, I'm also serving in the COVID-19 steering committee. Returning to the COVID-19 SARS-CoV-2 pandemic, I believe that California has a very unique and interesting position to actually set up the bar in data infrastructure California, it's going to be probably the only state in the world that's going to require that all new passenger cars and sold in the 2035 will be emission-free. So California has a rich history of setting the bar in terms of standards. And I believe that they actually have the unique position to set that bar and standard for data infrastructure, not only for the future pandemic, but anything related to that hazards. And that's it. Thank you, Michael.
And thank you very much. And our third panelist is Kathleen Jones from the Jet Propulsion Lab. Kathleen?
Hi, I'm Kathleen Jones. I'm from the NASA's Jet Propulsion Laboratory in Pasadena, California. My research is in using radar remote sensing to study both anthropogenic and natural hazards. I use this technology for trying to characterize oil spills, where's the thickest oil within a spill so that you can direct responders. I've used it in conjunction with the California Department of Water Resources to look at the levees in the Sacramento Delta. And as a spinoff of that, looking at groundwater withdrawal in the Central Valley of California and how the subsequent land subsidence has impacted the California aqueduct. Other things that I'm doing right now involve coastal resiliency issues, so subsidence in coastal areas, land loss and land gain, and the issues that affect whether we will be able to maintain some of these areas in the deltas around the world. One of my jobs is for NASA is that I'm the applications lead for an upcoming mission, the NISAR mission. That mission is going to provide a treasure trove of data about conditions on the land around the entire globe, sea ice in the Arctic and glaciers and ice and ice sheets and sea ice in the Antarctic, and a lot of information for ecosystem study. And that data, NASA provides that data for science, but the fact of the matter is that any of that data is vastly useful for disaster response, for disaster mitigation. And, being able to handle the amount of data that's out there is a really difficult problem, and it's a really important one. And so I'm very, very happy to be on this panel today and take your questions. Thank you.
Thank you very much. And earlier, Kathleen explained to me that mission, I believe, is going to be providing terabytes of data every day. And so that brings us to the topic of this session, which is really thinking about what kind of data infrastructure do we need to effectively respond to the next disaster. And so let's try to start, any one of you pick this up, what do you think the current gaps are? Where are the problems? Or in other words, what would happen if we don't change what we're doing today regarding storing and sharing and accessing data? Maxine, please, just kick it off.
I think the problem is what we've been experiencing, that the public health system doesn't have the data structure that it needs, and it is not integrated with the providers and the hospitals, so that there is rapid translated data and it's accurate and efficient. There is good electronic health records that are transferred between the provider and hospitals, but not directly transferable to the public health community. And that really needs to be done, so that we're not getting data a week later, we're not having it sent to a central place by faxes. And so in my mind, the most important thing would be integrating the hospital and provider data with the public health.
And I think that having a central kind of repository for a lot of data from different places is really essential to making that data meet its potential for use across the broad spectrum of capabilities that it could be potentially used for.
I agree with both Maxine and Kathleen. The most important factor right now is to have a centralized system where the data can not only be uploaded, but can also be revised, embedded. A quality of data is also very important. So, we're gonna have trash data. It needs to be very important and useful data. but it needs to be centralized. That is the most important factor right now. As Maxine said, we cannot have people sending facts or people just submitting reading documents. We need to have a centralized system where providers, hospitals, public health experts from different locations in the state can actually access and input the data.
Michael, you're muted.
It's all right, I'm a technologist, I can make this happen. Our next question actually comes from the VP of Research at UC San Diego. And I think this speaks, Sandra Brown, and I think this actually speaks to one of the challenges. Having the data is important, but people need to access it. And so could one or two of you just talk to what are the optimal models that could be used when we try to deal with ethical use of information? It's in really big databases. Sometimes these contain personally identifiable information or protected health information, especially in a pandemic. And how do we ensure that we have the ethical use of these data?
Well, to have the ethical use, clearly privacy has to be protected, and they've been able to do that in certain systems where they just remove the person's name and age, and you can the data systems can do that. We have accessibility of real-time data in other systems, financial systems and economic systems, weather systems. There should be able to be translated into simple facts that you need of, where the person has been, what kind of, let's take the COVID, what kind of symptoms does he or she have, where the provider knows if they hospitalized. There's data that's there and it can be standardized.
Thank you. That's great. Let me go to the next question, and this is from and I'm going to apologize if I get people's names incorrect. Susan Tatian, who's the chair of the Delta Stewardship Council. This actually talks to the whole question of having multiple data sets with different taxonomy. And the question was, do you have strategies or suggestions how to address the issues of different definitions and interpretations for key terms across platforms and data reporting formats? So how do we normalize data so we can fuse it in a way that actually we can extract the most value out of it?
Yes, I can tackle that. Definitely having a best practice documents is very important. Sitting down and making sure what is the language that is going to be used and what are the input. For example, you can have COVID-19, you can have SARS-CoV-2. People can call it common cold, people can call it, so there are different languages that people can use and they can have different interpretations, but having that initial standardized language is very important. And in a large data infrastructure system, that's actually going to be key. And of course, that document is not going to be monolithic. That document needs to be updated, and the community needs to be aware of data of that as well. And it's so important to have feedback from the community, right? Because a simple, nowadays with the social media, language is very important, in important key factor to use to communicate. So maybe some of that language could be used in this type of data system. Well, like I said, having a standardized language repository or data dictionary is very important.
I also think it's important to have the repository curated by, one group or that understands the entire architecture, so that they maintain consistency across it, because that's going to be key on making the data usable, is to be able to have it in a format that's consistent, and so one tool can access many different data sets.
And that gets to, you also need an open data system. So that, so the issues we have with the electronic health records, they're proprietary systems. And so that's not easily accessed or transferable. So I think, particularly when you're talking about disasters or pandemics of any kind, you do need open source data.
Great. And I actually think this whole question of how do we avoid if you will, a Tower of Babel when we're trying to deal with many disparate data sources is a constant a constant challenge. And when we solve it, we will have generated some real value. So this actually now, the next question actually goes to the question of who are we designing these data systems for? And I think one of the challenges, and we could look at COVID or we could look at wildfire, there are a vast number of people that need to have accurate and timely information to data. And it may be different frames of data, but they need those data. How do we think about the different audiences in designing a data system that can support a broad range of audiences, some of which, if you will, may not be perceived to be important when the event began? How do we create the flexibility? Cathleen, please.
Yeah, so just ideas. One thing is to have training on how to use the data and provide tools so that not only do you, bring the data to the people, but you bring them the tools that allow them to use this standardized set of data. Because frankly, if every agency has to develop their own tools to use it, it's going to be very unwieldy.
On the idea of tools, that's really one of the problems with the health system, that the IT systems at the CDC and others are not up to date. And they really need to be brought into the 21st century and using iCloud. And the CARES Act, which was one of the COVID acts, and it was passed by the Congress in 2020, provided $500 million for the CDC to upgrade their IT system and to work with the states and local governments. As of several months ago, they still hadn't spent much of that money. So, I mean, I think there's a real opportunity for states and public health groups to work with the CDC and leverage state funds with federal so that everybody is updating their IT system and bringing people in. I think that's the key. People solve problems that are experts in the area.
When we talk about data, there are two aspects of it. One is the data, and the other one is the data visualization. And we need to consider who are going to be our consumers. In this case, who is going to be using the data? We're going to be having researchers, we're going to be having medical providers, and they're going to be using the data in a very unique and specific way, which is different. For example, when you wake up and you open your phone and you see your weather, that weather app is going to tell you sometimes what is the pollen in this number in your area, but it can even tell you the flu season around your area. So imagine having a centralized app where the regular consumer can see that information, can have access of that information, right? But then you can have another different set of dashboard that can be used by public health experts, the governor offices as well, or public health experts. So that's the way that we need to think about it. But then you also need to have a system where people can actually download a spreadsheet of that data that is publicly available, but it's also has been vetted in a correct way that actually protects the private information of the people, because that way people can actually have access to that data, but it can also have the means to modify the data, visualize it in a different way. And maybe the community can actually pinpoint some errors and also share some best practices that can be implemented in the system. So that's the beauty between the data and data visualization involving the community.
Thank you all. So as Amber said, there's a working group at the council, and Jesus and I are members of it, looking at pandemic-related response. And one of our first workshops will be focusing in part on who is the public health system, who's involved with it, and what data do each of those constituencies need, and how do we, to the question that was asked earlier by Dr. Brown, how do we make sure that we are protecting the information individual information while making it useful for the decisions that have to be made? So,
and I think one of the things when you look at the public health structure, you've got California is blessed with having very good schools of public health. And in addition to having them involved in the public health agencies, but having the schools really involved, because they're the future of the group, and they also can help devise the data systems and all. So I think that's a lot of parts that California can make use of if you have who's going to develop the data.
Yeah. And we were talking to the people at CDC just earlier this week, and they also think it's important that we do that groundwork before we actually start building the next generation of systems. So we think about who the users are. So speaking of that, this question comes from Julie Meyer-Wright, who's the former Secretary of Trade and Commerce in California, and also is continuing to support CCST as a member of the Advisory Council and, pardon me, member of the Advisory Council, excuse me, at the California Institute for Telecommunications and Information Technology, Cal IT Squared at UCSD. And this is, if you will, the issue. Not everyone is a good actor. And so the cybersecurity dimensions are really quite critical. The governor of Virginia, for instance, put cybersecurity at the very top of his IT agenda for the state last week. So how do we deal with the data security issues of a central repository while at the same time making these data widely accessible?
That is a big issue that we deal with at NASA, as you can imagine. All of our data is open, but making sure that you have, I don't have an answer for that. I do know that it is absolutely critical, though, if you're going to have a trustworthy database.
And I'll just say every agency at the federal level really has a cyber. I don't know what NIH has, but Department of Energy, each laboratory has to have a cyber initiative and implement it and checking it for energy-related data. And it's just key. And I think it's becoming almost, anytime you develop a data system, the cyber has to be thought of at the same time.
Certainly, the cybersecurity factor needs to be involved. And as Kathleen mentioned, training is very important. One of the biggest mistakes or problems or how actually cybers can grab people is by social engineering, actually tricking them to give them the data or give them the password to gain access. So that's it's going to be very important. How folks are going to be managing the data, using your work laptop versus your home laptop versus using a USB versus using the cloud. Those small things are very important. So cyber actually starts with training.
Yeah. And I think one thing I want to add to that is if we think about designing these systems with the threats as something that we have to plan for to begin with, you actually can create some architectures between front ends and back ends that add a dimension of security. And typically when people design web-enabled systems, that's not something they put in. But nothing, if something can be broken, someone will find a way to do it. But we can make it a little bit harder. Cybersecurity and cyber threats are an economic problem, right? If it costs too much to get the data, people won't push. So thank you. The next question is from Douglas Akahoshi at UC Davis. And this is really interesting. Can we look to other nations? Are there examples of data infrastructures implemented elsewhere that could serve as models for how we think about designing ours? Have other nations done a good job on this that we can look at?
Definitely. The United Kingdom, through the National Health System, they have been very good at using the data that they have gathered from the patient's symptoms, their patient's recovery, vaccine surveys that they have done. And actually one of the first and longitudinal long COVID studies was done under the United Kingdom, and they rely heavily on the NHS system. The other country that has done a fantastic job at using their healthcare data has been Israel, right? So Israel has been able to track, we need to remind that Israel actually was the first country to use kind of like a live setting experiment using the Pfizer vaccine, and they were relying heavily on the data that was actually being shared by 2 HMOs in the country. So I suggest that both Israel and NHS, Israel and the UK are both countries to be looked at, for example.
Yeah, I would second what Jesus said on this. So they both had very good systems. New Zealand has actually had a very good system also with the data to the other side of the world that has, I don't know that people here have looked at the UK and the Israel system to see what do they have that we could apply here and to make our system better and more effective.
Thank you. I think what both of those systems have, by the way, is near real-time reporting from the healthcare providers into the primary public health system. And regrettably, the majority of the states in the United States still use a technology called facsimile for primary reporting, which can create something of a delay.
And as we said, that's, if you made my number one thing that should happen is integrating all those in an interoperable system that is fast, transparent, and accurate.
So Dr. Sandra Brown from UC San Diego has a follow-up question, and this sort of going back to the ethical use. Beyond privacy of data sets, analytical approaches and presentations of the data can be misleading with regard to implications for certain racial or ethnic groups. Specifically, are there expectations for data use agreements or recommendations for the analytical approaches, both the tools and the training, to address the kinds of inconsistency in results that we see that are based upon varying analytical approaches? And I think the way Dr. Brown's phrasing it, she's asking is, how can we prevent misuse of these very large data sets? Because one can, if you will, skew the data to different means and different ends.
Certainly, as Cathleen mentioned, training is very important, and training also needs to be done. How is data is used, how is data visualized, how is data analyzed, and then what is the statistics. And you need to be also transparent, and not only with the health expert and scientific expert, but also with the community. And there needs to be a conversation, right, about what is the definitions under the different underserved communities. And also, how is that data going to be used, right? How is that data going to be used to promote a better healthcare system? How is that data going to be used, for example, to evacuate specific populations in specific regions where there is a wildfire? Or if there's some flooding, how do you know how many resources you need to provide in a specific area? Or if there's a specific subpopulation that is being affected more heavily than others during a specific epidemic because of socioeconomic disadvantages or genetic problems. So that's the type of training and information that needs to be provided when it comes to this type of analysis.
One of the recommendations from our OPCAST study, acknowledging that there was this inequity, that we need to have a study to provide the reasons for the disparities, and are they really a result of broader inequity issues, not just health related, and whether public health and social demographic data is collected to address the issue, to see it. I also think, and to the consumer, the media has to be educated and trained to make sure that they present the right data and not a spin on it. And we just don't have, there's no control of that. And and we don't want to control it, but once it is released, how you can prevent that. Who are the trusted sources? And I think that there's a real question now in this country about who to trust and who to believe, and the health, not just COVID, but on many issues. And I think that's really one of the issues that needs to be resolved.
Yeah, coming from NASA, background, I think less of the public health information, which is what you're talking about, and more about the observations, Earth observations, and making that data openly available and easily available is a way to bring equity to different communities. You don't have to be specialized in order to access this information. So I view having this kind of a repository as a step in the right direction towards equity.
There are actually efforts at the Supercomputer Center at UCSD about architecting a data commons that would approach that very idea, that would be broadly open, easy to access, properly privacy protected. And it's maybe an interesting commentary on our times when two of the questions that have been asked have been, how do we protect against people utilizing the data, which we hope will be for good, in ways that are contrary to what we believe would be optimal. So let me go to the next question. And then this is, along similar lines, can you share your thoughts on the analytic capabilities that might be needed to interpret and use these data? Are there decent analysts and statisticians for the whole different range of topic areas that can take these data and present them in a way that the various user constituencies can access it?
One of my whenever I went from doing science to trying to engage with the more applied community, one of my hardest lessons rapidly learned was that my vision of what data looks like and other people's vision of what the information content is are very different. We have got to work with the communities that are going to use this data so that we don't provide just any data, we provide information. We provide the information they need in a way that they can understand it. And we provide, I believe, Jesus said this, it's got to be valid, really QA'd some way.
Well, this goes back to the training that's been coming up. I mean, if you look at modelers, if you look at epidemiological models, and Jason can give more on that even, there can be one model that comes out that will say one thing and another that says another, and it just confuses everybody. And there hasn't been a lot of research that has in some of the health areas that for epidemiological modeling to occur, and suggestion has been made, of course, that NSF and NIH should work together in having a program to develop this capability to be able to do that.
So going to the data analytics, we at NSF, us science analysts, we have taken training of how to use the data in an ethical correct way, but also how to visualize it. And even using a specific set of colors and patterns of the color is very important. For example, using blue, gray, and orange is very important for the colorblind community. And so that's a factor that some people don't think about it, but we get trained in that situation. The other thing that Maxine said, training is very important, how we can train the media, but it's also important how the media can help us train, particularly folks from marketing. Marketing folks are very useful and very savvy, and they understand the psychology of the folks that they actually are trying to convey their message. And that's also sometimes us scientists, we are not trained to be communicators, and we are trained to draw a graph that is going to be to a research paper, and the research paper typically goes to a scientific community. Now, research papers are becoming more and more open access to folks, and people actually have that capacity to see a research document with the graphs, but also, how can we convey that graph to the community and the population? Like I said, we can see the apps, we can see we have to be a little bit like the weatherman. We have to think about it. If you think about it, weathermans are folks that are always computing data and they're always transmitting every single day to the folks. So we need to be the weathermans in the for the healthcare.
And if I might, even on wildfire, one of the things is we've developed some really amazing systems aimed at the first responders, but we leave the public without those data because we don't design it to be accessible to them. And the public behavior and the public response is really quite critical during a rapid fire emergency. And it'd be interesting to have weather reports, if you will, near real time that were more broadly accessible and consumable by the public. So turning back to the dark side again, Julie Meyer-Wright appropriately raises the question of misinformation. And we know that, for instance, in the past election, the Facebook algorithms promoted some controversy in general. Facebook and other social media sites have algorithms because they're designed to drive advertising and not necessarily provide more balanced or neutral information to people. How do we create user agreements and enforce them to ensure that the data we're talking about are not used to promote misinformation?
I don't know how in a free society you can really do that. You can get people to sign agreements, but that doesn't mean they're going to live up to them. I think in some way, I look at NASA's data, it's always accepted. It seems they have trust, and everybody believes their data that's coming out from the work they're doing. The health providers used to have people, accepted their data. I think people still have a trust in their physician, and are they in some way able to get the data in a form that they can help explain it and be a trusted physician? And we just have to look at how, people really, Dr. Fauci was and is still people a lot of trust, but even he has been questioned now. So I don't know how you close that divide. I guess that's the question Julia is asking also.
Well, maybe one suggestion would be to start with a specific case, start with data for wildfires, for example, and work out the issues with cybersecurity and start with, something that's less controversial and less likely to be abused. Maybe that's not the right example, but start somewhere.
I think education is a very important factor, not only in the K-12 setting, but universities and in the general population of what is data, how it's used, and how to identify the misinformation. Misinformation sometimes is being used as a mechanism to question data, and in science we are always questioning each other, and that is healthy, that is important, that's how we move forward. But there's a big difference between being a lie that is being repeated versus being questioned about, is this vaccine specifically is better or is not better or is in this condition versus the other. That's a different whole story. So that's one thing that I would say is educating people about what is data, what is information, what is this misinformation.
Thank you. So Julie Meyer-Wright has dropped a note, and I think this is also important. When you're dealing with communications and you've got noise, if you will, in the system, it's really important that we have trusted sources of accurate and consistent information. And the AAAS, CCST, UC Riverside, and UC San Diego. UC Riverside has a newer science and policy program, and UC San Diego, we ran courses for government officials across the state for 3 years on communications and how to speak to the public and how to make sure that scientists can provide information to policymakers in a digestible manner, but perhaps more important, that we can get the information out to the public. And we can't stop misinformation, but I think if we don't speak the other data, it's more likely to become the primary thing that people hear if we don't provide consistent other messaging.
Well, it's interesting with the communication thing. Maybe that is something that should be brought into curriculum, for particularly at public health schools, where they're training the public health officials, be at medical schools also. But it's really, when we're looking at the public health community, them having that training at both the people who are starting to be public health officials but also those exist as, you know, continuing education things. Those schools could in some ways help to sponsor the ability to communicate and what should be and how you best do it.
Yeah, I think it asked the question, what should we be teaching in public health today that will have the impacts that we desire? And I think that's spot on. So let me turn to a question. You know, what can separate from the state, what can researchers or public health administrators do to enhance data sharing and optimize the value of the data beyond their own specific needs? So, you know, what can that part of the community do that achieves some of the goals the three of you have been talking about?
Well, one thing is there could be partnerships, even though you said not necessarily the state, but even with the state, you could have partnerships between local and state public health groups, between universities that are there that can help to solve these, and industry groups that have the technology to help to solve these problems of sort of a public-private partnership type of activity that would enable this to occur.
Any other ideas? We can go on to the next question. So what do you think the limitations are or the challenges are in terms of using data to understand disparities and health equity? And in terms of developing a data infrastructure, how can we do it in a way that helps us begin to better understand and shine a light on these things and maybe figure out how better to address those issues of health disparity and health equity?
Well, the data is as good as the policymakers and society uses for, right? And it can only be used, you can use data for a broad range of things, and definitely having a centralized system where captures data from the pandemic, and it can be used for solving inequality, providing better healthcare, to better planning, preparing for the next natural hazards, or having a better allocation of resources. Right, so you need to think about this data not only for one specific set of situation, but multiple range, right? But like I said, data is as good as the person who uses it. Data can, everything can be centralized, it can be automated, it could be visualized, but if nobody uses or implements it, you're not going to see any changes. But once you have data, good quality data in a way that can be accessed and seen by everybody, things are going to flow, and people are going to start. One of the consequences of the pandemic is that people are asking more and more for data. People want more data. They want more information. Like at home, we use our apps to watch TV. On our phone, we have different apps that can give us more information. We are wearing Apple Watches that actually are providing information to our phone, tracking our different paces and heart rhythm. So people are becoming more consuming information, and they want more of that.
But then one wonders, who distinguishes between good data and bad data? And I mean, the models are only as good as the data in and the data out. And who's the arbitrator of whether the data is good? When one's doing scientific experiments, it's easy to see, can you reproduce them? And I mean, it's a question, I don't know the answer. I don't know if others have the answer, but how does one determine what is good data?
I think it's important that we make certain that the data that are collected come from as broad a sample or representative of the whole population as possible, so that when we go to interpret the data, we don't end up with an inherent bias built into the data.
Yeah.
The NIH funded a program called SEAL that was intentionally during COVID trying to make sure that we had as much information on typically underserved populations. And I think it's been an impressive program, both in terms of ensuring that the clinical trials were as genetically broad as possible, so we could make certain we didn't miss things when we're developing the vaccines, and then testing and now vaccinations. But I think intentionality of being inclusive is one of the ways we can begin to do that. The next question comes from a gentleman, John Helly, and it's a really fascinating one. There have been decades of work done on publishing data and digital libraries, but there's not been a lot of intentional. The Obama administration, Maxine, did start a lot of work on open data. The current California administration is working on open data. Do you have any policy approaches to the broadening of data publishing and well-curated digital libraries? And I think this goes back to some of the stuff we discussed earlier. And I know, Kathleen, your parent institution works on this topic a lot. So any policy recommendations on, curating data and explaining the publishing of these data?
Well, in the health fair, this is where the CDC can play a role. And, they've been funded, as I mentioned, in the CARES Act to develop a modern IT system and implement it. And they could, they could pull together, experts in the area to have it done. And CDC has just set up a group to a new disease forecasting center that is supposed to set up modeling for forecasting, on a national basis, led by Mark Lipschitz from Harvard, who is spending time there. That's a step for one part of it, but it's going to take resources to do that, and I think having technical expertise and leadership at a place like CDC with and bringing in IT people to help them. That was one of the things that you said. One of the things the Obama administration did was bring into IT experts working there from Silicon Valley and others that were really able to push that in broad areas.
NASA has these, they're called DAAC, D-A-A-C, Data Active Archive Centers. And I think there's 7 or 8 around the country with different centralized themes. Like there's one for land processes, one for oceanographic processes. And those are curated collections of data where the data, NASA's data, either directly from instruments or output from experiments, are stored in those repositories with curators who make sure that there's information about how to access them. I think what we're talking about here is not just one, is bigger in a sense. It's across more than NASA. It's across many, many different agencies, possibly including international data sets that are open for Earth observing data sets. So maybe taking some of the experiences from the active archives that NASA uses and trying to expand them would be one way to start.
The National Science Foundation actually has funded multiple data repository centers, as you can call it. For example, Natural Hazards Engineering Research Infrastructure, the famous NHERI. They actually have a network coordinating office, a computation modeling and simulation center as well, and post-disaster. They also have a rapid response research facility as well. So NSF has provided research for the natural hazards, and more recently with the COVID-19, they have funded supercomputer centers where they can actually analyze data and centralize the data, which is important when we're thinking towards the future, how the centralized information can actually be stored, but also we can have backups of that information, right? We cannot think that everything is going to be under one cloud. Well, I mean, if something comes in and pops the cloud, when you lose everything, there needs to be backup of that.
Thank you. So this is a really giant field, and I know there's been a ton of other work done. We don't have time in an hour to cover all the work that all of you have been doing in the past. But let me ask one last question. We've got around 4 or 5 minutes, and then looking ahead, what do you think our main data needs are, and who is really best positioned to address these needs in the context of the public mission, the authorities and programs, and the data resources? How do we make sure we figure this out, both the data and the infrastructure to enable it? And then lastly, could you just think about what role can the state play in supporting a robust data infrastructure? So if we come back here 5 years from now, we can look back and say, boy, we solved half the problems we were anticipating.
Well, I will just go back to what I said in the beginning. I think the most important thing is still, the integration of the hospital and provider data with public health data, and to be seamless and timeless, and automatic systems that get updated, timely reporting, links, and that electronic health record. And it's really going to take, commitment and money to be able to do this by the public at large. And I think the way the state can do it, and there is in the state assembly appropriations bill something like $235 million for COVID related things, and a part of that is for public health. And I think making use of that money for developing the models, putting together the people who are expertise, and also hiring the experts into the executive, into the academia world, upgrading with the people. That's who really makes things happen. Is a useful thing, and setting up programs at the universities. I mean, it's interesting that during this beginning, the university information from Hopkins and University of Washington is what we all trusted as to where they were going and what was happening, and could set up centers for modeling and data research at universities, much like California set up with nano centers years ago. You're on mute.
You're on mute.
I was just going to ask Kathleen or Jesus, we have a couple of minutes. What do you think? What is the role of the state, and how do we ensure we get this done the right way?
Well, I agree 100% with what Maxine said. I will add, to what I said earlier, there needs to be training on this area. There needs to be best practices how the data is going to be used and visualized. That's another important factor. Who are going to be consuming this data, right? The people from the state of California, the folks outside from the state of California, the stakeholders from the California, the NGOs, the private sector, the hospitals. We need to be thinking about how are we going to be visualizing this information, and how are we going to be making decisions using this tool. That's the other part that we need to consider. And I believe that the state of California has, like I said at the beginning, a unique opportunity to set the bar.
So I know from talking to the people at the different agencies that they do not have the bandwidth to take something like this on. They don't have the funding or the bandwidth. I think you need to set up a separate project, and I don't know who at the state would take that on, but I do know that it's not going to be something that is small or easy. The scope will be large.
Well, we are at time, and I apologize we weren't able to answer all the questions that came, and I'm sorry we aren't going on for 2 hours, but I want to thank the three of you so much, and it's always a delight, and I'll pass it back to Amber.
Thank you, Michael, and thank you to the three of you as well. What a wonderful conversation, so rich, and like you said, Michael, we could have used so much more time. What excellent questions from the audience. I love this conversation. For those of you who want a second view, we are recording it. It'll be available at our website. We'll also send this out to everyone who registered, so you can share it with others who you think might be interested in this topic. We do have a one-pager on our website as well, so that you can have the contact info of our wonderful experts here today. I want to thank our CCST team who does all the work behind the scenes to bring you this type of event. They just do a fantastic job, and I want to thank all of you for joining, and to our panelists and moderator, thank you for your time and expertise and your forward thinking in this space. I look forward to seeing you all. Have a wonderful afternoon. Bye-bye.